circling Ontario's legislature. Health workers, advocates, and families who have lost loved ones in long-term care homes.
The staffing crisis in long-term care is now worse than it was prior to COVID-19.
This protest on the same day as a troubling report from the province's patient ombudsman. Between March and June of this year, the ombudsman received 568 written complaints.
Particularly hearing from people who'd been left alone for days. It was very hard to hear from family members who were just so distressed that they couldn't see their parent or their spouse.
Healthcare workers and staff said they were afraid to go to work. One said staff were told to work even after testing positive.
Particularly concerning was a number of whistleblower complaints.
The ombudsman made 4 recommendations. Every healthcare provider must have a contingency plan for things like staffing and training, ensure visiting access for caregivers, communicate better, and protect whistleblowers who speak up. Maureen McDermott isn't surprised by the report's findings.
They were in their rooms for over 100 days. That can't happen again. It absolutely can't. I won't watch my mom die of a broken heart through a dirty window again.
Her 93-year-old mother, Elsie McDermott, survived COVID-19 after an outbreak at her long-term care facility this past May, but 39 residents died there. Her mother in isolation again, awaiting test results after a runny nose.
There's already PTSD creeping up in me, seeing these reports, other homes in outbreak, and I'm like, here we go again.
Right now, 57 long-term care homes have an outbreak in the province. This home behind me is one of them. Today, Ontario's long-term care minister says investments have been made in PPE and staffing, and they are better prepared this time. Tashana Reid, CBC News, Toronto.